Today we're breaking down one of the most confusing hair topics: hair shedding versus hair loss. If you're seeing hair in the shower, on your pillow, or in your brush, this video will help you understand what's normal, what's not, and when you should take action. Hair shedding and hair loss are not the same thing, even though they look similar at first. Let's start with hair shedding. Hair shedding is a normal biological process. Every hair on your scalp goes through a growth cycle with three main phases. Anagen, growth phase, lasts 2 to 7 years. Catagen, transition phase, lasts about 2 weeks. Telogen, resting phase, lasts around 3 months. At any given time, about 10 to 15% of your hair is in the telogen phase, preparing to shed. Because of this cycle, losing 50 to 100 hairs per day is considered normal. Some people may shed slightly more without having hair loss. Shed hairs usually have a small white bulb at the end. Hair shedding does not mean follicles are damaged. Now let's talk about excessive shedding, also known as telogen effluvium. Telogen effluvium happens when a trigger pushes too many hairs into the resting phase at the same time. Common triggers include physical or emotional stress, illness, infections, or surgery, rapid weight loss or calorie restriction, hormonal changes, postpartum, stopping birth control, iron deficiency or thyroid imbalance. Key facts about telogen effluvium. Hair loss starts 2 to 3 months after the trigger. Hair sheds diffusely across the scalp, not in patches. The hairline usually stays intact. Follicles remain alive and capable of regrowth. In most cases, shedding stops within 3 to 6 months once the cause is corrected. Now, let's move to true hair loss. Hair loss happens when follicles become miniaturized or damaged, producing thinner, shorter hairs over time. The most common type is androgenetic alopecia, also called pattern hair loss. In women, hair gradually thins at the crown and part line. The frontal hairline is usually preserved. In men, receding hairline and crown thinning are common. Key differences from shedding. Hair loss is progressive, not sudden. Hairs grow back thinner each cycle. Density slowly decreases over years. Without treatment, follicles may stop producing hair. A critical hormone involved is DHT, dihydrotestosterone, which shortens the growth phase and shrinks follicles in genetically sensitive individuals. Now let's clearly compare shedding versus hair loss. Hair shedding, sudden increase in hair fall, often triggered by stress or illness. Hair diameter stays the same. Regrowth usually occurs. Hair loss, gradual thinning over time. Genetic or hormonal influence. Hair strands become finer. Regrowth becomes weaker without treatment. A simple at-home check you can do is the part line test. If your part is gradually widening over months or years, that suggests hair loss. If your part looks the same but you're shedding more hair, it's likely shedding. Another useful clue is hair texture. Hair loss produces softer, thinner hairs. Shedding produces normal, thick hairs. Now let's talk about what actually helps. For excessive shedding, identify and correct the trigger. Ensure adequate protein intake. Check iron and thyroid levels if shedding persists. Be patient. Regrowth takes time. For true hair loss, topical minoxidil has the strongest evidence for both men and women. Early treatment leads to better outcomes. Consistency matters more than frequency. What does not work? Shampoos alone do not stop genetic hair loss. Supplements without deficiency won't reverse follicle miniaturization. Detox products do not reset hair cycles. When should you see a professional? Shedding lasts longer than 6 months. Hair density continues to decline. You notice scalp changes, itching, or inflammation. Early diagnosis matters. The earlier hair loss is identified, the more follicles can be preserved. To summarize, hair shedding is usually temporary and reversible. Hair loss is gradual and progressive. Triggers matter, timing matters, and follicles matter. Correct diagnosis leads to the right treatment. If this video helped you understand what's happening with your hair, like and subscribe to Dr. Follicle for evidence-based hair and scalp education. Thanks for watching, and I'll see you in the next video.